Welcome to Elixir Inspire event, a very short one this week because we're going to be looking at a specific area with Sara Kirkham. So Sara, you've met before, and she's on one of our other videos on YouTube to talk about her nutrition that she offers through Elixir. But today we're going to be talking specifically about something that's highly topical at this time of year. We're in spring, and it's actually April at this moment in time, so highly poignant time of the year to start looking at allergies. And we've invited Sara to come along and talk about what she can offer in terms of testing for that, but also looking at the connotations of why we get allergies and such. So I'll just hand you over to Sara. She can introduce herself briefly and explain what we can do. So over to you, Sara.
Thanks, Neil. So hi everyone, I'm Sara Kirkham, so nutritional therapist at Elixir in Weybridge. And yeah, I guess allergies and food intolerances are one of the most common things that I see people for. There are lots and lots of different types of what we usually use the broad term allergy. Lots of different types of allergies and intolerances. So some are antibody related, so we have the classic allergy to something, which is IgE antibodies, for which York Test, who I use, the York Test labs, do offer an allergy test kit for that. And we also have IgG antibodies, also part of the immune system, but that relates more to food intolerances. And then, of course, we have respiratory allergies, which is, the most common one we know is hay fever. So different ways that the body can respond. One thing they all have in common is inflammation. So there typically is something imbalanced in the body that makes us overreact to something, whether that is grass pollen or tree pollen, or eggs, gluten, dairy. For some reason, whether it's the respiratory cells or whether it's cells in the gut lining, something is becoming inflamed when we overreact to something. So testing can be a really great first step thing to do, actually, because otherwise you can find yourself just going around in circles for years and years, just trying to figure out what it is that you're reacting to, especially with foods, cutting out dairy, and then, things might be a bit better or maybe not, and then you cut out wheat. Now you're not quite sure, is it wheat or gluten? So the most common food intolerances by far are dairy, in particular cow's milk dairy, and wheat and gluten. But I have to say that egg intolerance and yeast intolerance are also right up there. And when someone first comes to see me with various symptoms and they think they might be reacting to something, a test is one option. Going straight onto an exclusion diet is another option. The problem with an exclusion diet is that we're sort of just going with, you can go with symptoms, and if someone knows that they're reacting or having symptoms after a specific food or specific meal, sometimes it's easy to spot what might be causing the problem. But sometimes it's not easy because most meals have lots of different things in them. So the benefit of a test is that you can save weeks, maybe months, going through different exclusion diets, taking out dairy and then taking out wheat and gluten, maybe eggs. And whenever you take a food group out, of course, you're altering the diet. It can be quite difficult to follow an exclusion diet. So in one way, why would you do all that when you can have a test that will tell you what you're actually reacting to? So the food intolerance test is one of the most common things that I see people for. It's currently £120. That price does change depending on various offers that York Test have. But this is because it's a proper lab test. So this is a blood spot finger prick blood test. The sample goes off to the lab and they test 208 different foods and substances for intolerance. And then you get literally a sort of traffic light based test result back, scores of 0 to 100, and anything from 20 up to 100 is classed as a high reaction. Anything from 12 to 19 is a borderline reaction. Anything below 12 is a normal antibody reaction. So the test results are very clear to see, and that they're a great tool to have, really. And they take about a week at the lab. They're pretty quick with turnaround, sometimes only 3 days.
Okay. And then after you've received the tests, what happens next?
So sometimes clients might have already had a consultation with me, because a food intolerance test isn't always the best test for people. Sometimes if there is a lot of bloating involved, after taking a health history, I might say, actually, I think a test for SIBO, small intestinal bacterial overgrowth, is a better test, a better way forwards. Sometimes it might be a stool test. You know, I might think that there's really a clear dysbiosis, which is when the bowel flora is unbalanced. I might think that there's digestive issues, which the stool test also will show. So quite often I'll suggest a consultation first, because then I can signpost that client to the best test rather than just jumping in with a food intolerance test. But when we get food intolerance tests or any lab tests back, then we look at the results, and with the food intolerance results, you're probably then looking at an exclusion diet. So I will provide an exclusion diet individual to that client. So whether that's having to take out wheat or gluten or dairy or eggs or broccoli or celery. Quite often you'll see linseeds in there, and rapeseed also. And these are things you just wouldn't think to take out of the diet. So we'll look at what the test results have shown, take the offending allergens out, and work with that for 12 weeks, because it takes 12 weeks for the immune system to desensitize to those food allergens and stop producing antibodies at such a high level. At that point, you may be able to bring those food allergens back in and incorporate them into the diet.
So it's not necessarily a removal forever. This is something that you can play around and move around depending on the results that you get, but it gives you the opportunity, I guess, to then have a look at those specific food groups and say, right, that is definitely causing me the problem at the moment.
Yeah,
I can remove that, but I really like drinking cow's milk or eating cheese, for instance, and so I will try and then bring it back after a few weeks, and then see what happens. And then if you get the same reaction, then you know, well, actually,
because some people do have a lifelong intolerance, and where that's the case, very often there may be some element of genetics or familial history involved. So some people will find that after 12 weeks they reintroduce the food, and they're still not able to digest it properly, still getting symptoms. But until you do a test and do the exclusion and then reintroduce, you simply don't know. And with regards to dairy, what I find really useful about the York intolerance test in particular is that it tests separately for cow's milk, goat's milk and sheep's milk products. So very often, I would say, bearing in mind I probably see maybe 25 to 30 test results every single week. I would say 75% of the tests that show a dairy intolerance are only to cow's milk, not to sheep and goat's milk. So that's really helpful actually when it happens that way, because that means you can still have goat's cheese and sheep's cheeses, sheep's milk cheeses, yogurts and butter made with those milks as well. So it really makes a dairy exclusion diet a lot easier, and means that you've got a wider range of nutrients still remaining in the diet, such as calcium, magnesium, vitamin D, for instance.
Excellent. Now that will be good news to a lot of our customers, because you know, they don't necessarily want to just cut total food groups out.
Yeah.
And it gives them the chance to have a few options on the
Yes.
table.
Yeah.
Okay, excellent. So we've talked about the food intolerances and food allergies. Should we talk a little bit about the respiratory allergies?
Yes.
Mhm.
So York do also offer an allergy test. So we've been talking about the intolerance test, which measures IgG antibodies.
Right.
They also offer, and other labs do as well, so Genova, Biolab, several other labs offer a similar test, measuring respiratory inhalants. And this is looking for IgE antibodies, which is a totally different antibody. The York test in particular does a combination one. And if anyone's interested, they can go online. If you just put in York test allergy, you'll find their website and you can find the tests and see what's measured. On their allergy test, they test a couple of dozen respiratory inhalants, so things like tree pollen, grass pollen, really common grasses and grass seeds that you find in the UK. Also mold. So this is another common one that comes up, that people just don't realise that they have an allergy to mold spores. And you know, I mean, we're based in Cornwall, which great weather sometimes, but also quite a damp climate as well. So a lot of people do have, you know, bits and pieces of mold, especially if properties are older. So that's a really common thing to be tested for. And cat dander, dog dander, horse dander, which people don't always want to see the results of if they've got pets. And that is combined with 24 of the most common food allergies. So this is different from intolerance. Sometimes people do both, and York Test do a bundle where they offer the intolerance test and the allergy test together. And it's not uncommon to have an allergy but not an intolerance to a food, and the other way around. Sometimes it's both, but quite often it's different. It just shows you the difference between the antibodies. So they, in the allergy test, they only measure about 24, but they choose the most common food allergies. So things like egg white, wheat, gluten, apple is on there because that's really quite common, soya, yeast, things like that. Other types of tests would include, so for instance, there is a test you can do for histamine. So sometimes when people have been getting symptoms for a while, especially if they are skin rashes, hives, urticaria, they start to think, is this a histamine intolerance? And this can occur, a couple of different things might be happening. It may be that you're producing too much histamine, or it may be that you're not breaking down histamine quickly enough. So there is a test. There's a test to measure histamine, which Medichecks offer, medichecks.com, I think it is. But that is a venous blood test. So you would have to get the test kit and take it into your GP surgery, or go to a Bupa or a Nuffield surgery to get the blood drawn, or go to your GP and see if they can do a histamine test to see what your histamine levels are. The other type of test is to check for an enzyme called the DAO enzyme, which breaks histamine down. So that's just another thing that if I see someone with allergies or possible histamine intolerance, we chat through all of these options. And very, very much, I'm just signposting people to say, well, we can do this test, you can do this test, or we can go with a low histamine diet. and just looking at all the options, and then it's up to the client to make the choice depending on how it suits them.
But that's the thing, if one of our customers is suffering from bloating or skin rashes or some kind of intolerance or allergy, whatever it may be, they probably don't know what the fundamental problem is right now.
Yeah.
This gives them the opportunity to find out and nail what is the problem.
Yeah.
And then with your advice or the advice of a doctor or wherever they may be signposted, they can come and deal with that issue and get a resolution. And
absolutely.
fundamentally, that's what we're after.
Yeah, and that's why I, rather than just straight away do a test, I prefer to do a consultation first, because sometimes I might say, actually, a food intolerance test is not the right test for you. You know, it may be that it's, you know, I'd be going more down the histamine route, or you know, a low FODMAP diet is needed, because interestingly, a lot of people will think they're having a reaction to something like, for instance, wheat, and then the food intolerance test might come back and show no problem with gluten and no issue with wheat proteins at all. You only produce IgG antibodies to food proteins, but of course there's a lot more components in a food than just protein. And a lot of people do react to the fibre in wheat, which is known as a fructan fibre. So for some people, straight away, I'll say, do you know what, I think a low FODMAP diet might be a better option. With regards to respiratory allergies, something like hay fever, dietary adaptations can help. So I'm also always thinking about inflammatory pathways, because if someone is allergic to something or has lots of reactions to things, it can be that the inflammatory pathways are unbalanced. So for instance, you might not be taking in enough anti-inflammatory omega-3s, especially if you don't eat fish, for instance, where a lot of those are. But you might be having too many pro-inflammatory nutrients, like arachidonic acid, which comes from meats. There's you know, various pro-inflammatory proteins in, for instance, wheat and lectins. So it may be that there's an imbalance in the inflammatory pathways. So then I might look to adjust the diet, maybe go with supplementation. So supplementation is a stronger way of dealing with things. So I like to think of things as, you have a therapeutic diet here and you have medications here. And for me, supplements sit in the middle, because they have a stronger effect than diet, because you're taking in higher levels of most of those nutrients. But you don't have all the side effects that you can have from medications. So for inflammation, you can be looking at things like omega-3 fish oils, or for vegans, you've got the DHA, EPA vegan alternatives. Especially with hay fever, you might be looking at something like bromelain, which is an enzyme from pineapple, which has got anti-inflammatory and antihistamine effects, or quercetin, naturally found in foods like onion. But again, you'd have to eat so many onions, you just can't do it with onions. So it's great to include onions in the diet for lots of reasons, but a quercetin supplement can be really helpful. And another one,
again, quercetin as well, having an allergy test would decide whether you have an allergy to onions, whether that's going to be an actual supplement that you could have that you wouldn't know otherwise.
Absolutely. And yeah, I mean, with supplements, you know, there's lots of ingredients and things that go into those that you have to take account of, as there are in medications. I mean, there's lactose is a common ingredient in medications that if someone has a lactose intolerant, the medication may be contributing. Obviously, you'd need to go and see GP about getting a lactose-free option in that case. Another one with hay fever that I look at as well is the nigella seed. So nigella seed oil, which is a natural antihistamine. So the way that works is it actually blocks histamine. So some of the supplements we've talked about, will affect the histamine release, so not as much histamine is released, but some actually block the histamine. So if you can imagine a cell in the body, and the cells have receptors on the outside, as the histamine comes along in the bloodstream, if the component from nigella seed oil is already blocking that receptor, the histamine can't have its histamine effect on the cell. So nigella seed oil or nigella seed oil capsules can be helpful.
Excellent. Okay, well, I'm going to cut it short because I want to keep it short and sweet for the customers. If you need to get an allergy test, if you're feeling bloated, or you have skin rashes, or you're sneezing a lot, or your nose is running with, or eyes are running, and you don't know why, any of these issues, you've probably got an allergy or intolerance. So get in contact with us. We can hook you up with Sarah. I recommend having a consultation with her first. Make sure we get the right test for you, and then we'll get your results back, and hopefully we can get you on the mend soon. So thanks for watching, and thank you, Sarah.
Thank you.
Bye.
Bye.